Welcome back at 9:15. Children's Hospital just debuted a new outpatient specialty pharmacy. It coincides with National Pharmacist Day later this week. Joining us with details about the service this pharmacy provides is Erin Piper, a clinical pharmacist with Children's Hospital. Good morning. How are you?
Good, doing great. How are you this morning?
I'm great. Thanks for asking. All right, so we're talking about the specialty pharmacy. Everybody understands kind of, how the pharmacy works, on the corners around the neighborhoods and whatnot. But what is the specialty pharmacy? What does that entail?
So what it entails basically, since we're inside Children's Hospital, we really help the population side of Children's. So what we do is we complete pre-authorizations with insurance companies to help children and patients get access to like high dollar complex disease state type drugs. Then we manage those drugs and their disease states, and then also we, advocate for access to certain drugs that are hard to find to help the patient population here in New Orleans.
I guess the big thing too is, when you have patients who maybe they, had some sort of a surgery or treatment or whatnot at the hospital, you want to make sure that they don't have they don't skip any, sort of medication that they may need that's important to them once they start heading home, right?
Correct, exactly. So we also offer like an amazing bed meds to bed program here. So what basically is we provide discharge medications to patients before they leave the hospital. So there's no lapse in therapy and no like rebound to hospital visits. So that is a great service that we provide here now at Children's, which is new. So it's very exciting.
Right, you can imagine, especially, so I know some folks, and I'm sure some parents out there have experienced some issues in finding even some over-the-counter medicines for their children, but it's so important to make sure that these kids have what they need. And you'll also have some of those medicines as well.
Correct, yeah. So some of the ones I know that are like hard to find right now are like amoxicillin and Tylenol. So we do have those right now in the outpatient pharmacy that we are able to provide and offer for our patients and caregivers here.
One of the things, when we look at, these hospital bills and things like that, man, sometimes parents you have to bite the bullet and pay for some of these medicines that can be very expensive at times. Is that something that you're also working with your patients with?
Yeah, so a service that we provide is finding like a financial assistance, whether it's in the route of like copay cards or grants or patient assistant programs. So we do help facilitate those processes to, whatever method it takes to get the medications to the patients and caregivers, we help in that process.
Yeah, it's so important. I mean, I just can't imagine, being a parent and not having the ability to find what you need and having to, you're pulling your hair out trying to find the right pharmacy, but Children's is making sure that everything is going to be taken care of. Anything else that you think the folks at home should know?
No, just that we're new. We're inside Children's Hospital. We're on the second floor across from the Sky Bridge. And everybody, we're just willing to help. We're, looking for new business.
Can anyone show up? If I have my child, it hasn't necessarily been treated at Children's, is it okay to show up and, try and have a prescription filled? Is that how that works? Or?
Yeah, so we're an outpatient pharmacy. We do take walk-ins. We service the employees here. We take specialty prescriptions, and we do the meds to bed program inside the actual hospital. So those are all the functions that we serve.
Perfect. All around. I appreciate it. Hey, thanks so much for joining us this morning. I'm glad we could get the message out.
Thank you so much.
Absolutely. All right.